Hi, I'm Colin Hung with Healthcare IT Today. Thanks for tuning in. Today, I got the chance to sit down with Jason Considine, Senior Vice President and General Manager of Patient Access, Collections, and Engagement at Experian Health. Jason, is there something unique that Experian Health is doing right now to help with COVID-19?
First, what Experian's doing in response to COVID, I like to take that a little bit higher level just to start, because we're doing some really interesting things around the world, not just in health, to help businesses and consumers in addition to our healthcare customers. So,
love it.
Example of something we're doing globally. Again, in the United Kingdom, we made our affordability passport product available for free, and that helps consumers make available their financial data. And the hope is with that people, lenders and things will understand vulnerabilities that people are experiencing due to the COVID outbreak and help them get assistance into consumers' hands where it's needed. Right. Wow. And then here locally in the US, we created a jobless risk index that helps people understand different industries and how they might be impacted more so than others. Other industries related to the outbreak, we've made business credit reports free in the US for a period of time during this outbreak. And we're also launching a free consumer education platform. So we're seeing hiring freezes and layoffs and job losses. Consumers are going to be impacted by this, and we want to help people understand how credit works and make sure that they manage their financial situation to the best of their ability. And we help get help to consumers in response to this.
Wow, that is incredible. So you're not just helping healthcare organizations, which I do want to hear about as well, but you're helping just the public just kind of get access to credit and just helping them so that lenders can understand their situation. That is amazing. And how is that done? Is that just through an app? Is that through something they sign up for and get a report on that they can hand to somebody? How does that work for the consumer?
Yeah, some of it's done via an app, like the credit education platform, something that's being hosted on Twitter and through social media platforms. And so we're leveraging a lot of different capabilities to get this in the hands of consumers, small businesses, and help them manage through this uncertain time during the pandemic.
Wow, awesome. So what are you doing specifically in health?
Yeah, and if we bring it a little closer to home and health, we're doing a lot of things with our technologies and and donating things like equipment. So one of the first things we did, we had 12,500 masks that Experian had on hand to help manage through any business continuity thing that we might experience. We donated those to a local Orange County, California hospital to help with the personal protective equipment shortage. And then we're also doing a lot of things with our technology. So one of the things we help our provider customers do is schedule appointments with patients. And we saw an opportunity that was brought to us by Blue Cross Blue Shield of Tennessee to help publish questions in the scheduling platform to help screen patients that might be need to come in for COVID-related treatments and triage more effectively up front. And so we're seeing customers ask us to make these changes in our applications to help them manage through this the change in the patient traffic that's coming into their facilities.
Nice. So you were able to adopt your system fairly quickly, it sounds like, to handle those extra questions that needed for the patients to be screened. Like, I'm assuming things like travel. Have you traveled recently to any of these places? Are you experiencing any respiratory issues? Oh wow, okay.
A lot of the questions you'd normally want to ask in a screening process. What insurance do you have? Things like that. We modified those questions to be the typical the COVID related screening questions that providers want to ask. And then nice. in addition to that, we have a tool, and we just published a press release around this a couple of days ago, around our payer alerts product. And what it does is it tracks changes, policy changes that payers make on their websites, and we aggregate that into one application that our customers can subscribe to and get notified when payers make changes. And there's been a large number of changes, as you can imagine, that have been made by insurance companies related to this outbreak, and things about how reimbursements are going to change, billable codes have changed. We consolidate all of those alerts into one dashboard that a provider can go to see all the changes. We made that available for free to the market, and announced that just a day or so ago.
Wow, that's incredible. And was that a new product, or was that an existing product that you made free?
It was an existing product we've had available to customers for a while. We made the COVID related alerts available to everyone in the market for free.
And I read in the press release there are about 1,200 alerts already that system has. That's incredible. 1,200 changes that have come through.
There have a lot of changes, and it's been online for a very short amount of time, and the response has been absolutely fantastic from our customers. Some of the feedback we've got is that there were people actually having full-time employees go out to these different websites and just try to understand and aggregate all the different changes for management teams to understand. Us putting that all in one place for people to go to has really helped make it easy for people to understand the different changes payers are making and manage it efficiently.
Wow, that's awesome. So it's early days. I'll be interested to catch up with you afterwards in terms of like how many people have been using it. I'm assuming really it cuts down on the number of errors and things that so therefore people can get paid faster. Is that kind of the idea of what the alerting product is supposed to do?
Yeah, that's exactly. So that's one of the things. Any change really a payer makes, we will find that change on their website and then consolidate it into this alerting system. And so there's been a number of changes that payers have made as a result of COVID-19. There's new billable codes that have been added, new policy changes that can affect reimbursement and other things. And that certainly helps reimbursement be done more quickly, and also understand if there's different administrative things that somebody might need to do in the way they do business with a payer. We alert them of those changes as well.
So given the breadth of services and things that you do in healthcare, is there anything you're seeing in particular that has changed most for your customers?
Yeah, I think well, our customers, like most, are being impacted by obviously no one's seeing these elective procedures, right? And so all of our customers are hyper focused on treating patients related to the pandemic and stopping the spread of the disease. And so some of the things that are impacting them from a business perspective that we noticed is they've been asked to send all non-essential employees home, just like we are all doing, right? I'm talking to you from my home office. We have a lot of customers that are in these hot spots that have had to send their call center employees home, that are typically in a facility calling people to collect on their open balances or helping them get connected with different financial aid vehicles. One of the products that we have is a solution called Patient Dial. It's a cloud-based dialing system that connects patients with these customer service representatives. So we helped our customers get those people set up to work from home and be able to do their job from home and connect from a home computer and still talk to patients and help them pay their bills and get connected with different financial screening vehicles through that process. So lots of those types of changes that customers have been asking us to help them through. Simple thing like getting people set up to work from home. And then other things that we've seen is patients are wanting to do more business online, right, with their providers. And so whether this is logging into some telehealth application or simply engaging through a portal to look up their medical records and pay bills, they need to authenticate through that system. And so they're asking Experian to help them prove that that patient on the other end is really who they are, and authenticate them and allow them into their medical record application or their telehealth platform. And so our Precise ID solution does just that. We're seeing a big response to using more tools that help remotely authenticate people and allow them into the application.
So kind of a related question to that, Jason, is there something that you're seeing that's going to come to us on the horizon as we emerge from this pandemic, or just even, a trend that you're seeing, a macro trend that's going to continue that the media really hasn't covered yet?
Yeah, I think one of the things we're seeing and we're investing in a lot is allowing patients to self-serve more through the healthcare experience, right? And so we acquired last year. We acquired a company, My Health Direct, that helps patients manage scheduling their own appointments. And then we've also launched a solution called Patient Financial Advisor that will send a patient an estimate for their cost of care and allow them to pay for that service before they ever arrive inside of the facility. With all the awareness around price transparency, we're big believers that as patients, I know I want to know what I'm going to owe before I go into the doctor. We're making that easy so that patients can understand that and then pay their bill, get connected with options to pay their bill before they arrive. And then we've also put into market a registration accelerator solution that allows patients to simply authenticate by taking a picture of their driver's license and then a selfie, and then enter take a picture of their driver's license, insurance card, and easily navigate the registration process from the convenience of their home. And so that we're already seeing a big demand for those products prior to COVID. I think we're going to see a big acceleration in things like telehealth and the need for these self-service solutions, because consumers and patients just aren't going to want to sit in an office around a bunch of sick people where you could contract something. I think there's going to be a new awareness around that, and we're all going to want to do more online, do more of these remote types of visits, and have tools that allow us to do all the paperwork that we're typically doing inside of a provider's office from the convenience of a mobile application.
No, I love it. And I totally agree with you. I think that, waiting rooms are going to be things of the past now, or they're only going to be in places where you need a very acute or urgent care, where you're going to tolerate, being in one of those rooms. You'll much rather want to check in ahead of time, and definitely you don't want to be sitting in there doing paperwork. You'll want to do that at home, in a safe environment. And I think now, you're right, we're much more keenly aware of that.
Yeah.
If you were put yourself in the sort of client's shoes right now, what's the one problem that you hope that if they have, they will call you for?
We have so much data that helps our customers navigate the revenue cycle and identity process in healthcare. I think I would say in general, nobody is better at us at making sure that all of the things that surround getting the bill paid by the patient or by the payer better than Experian. And so anything, claims, eligibility, kind of all those patient access and back office billing services, or price transparency solutions, registration related problems that customers have. What's unique about our business is that we have the data to help them drive the best decision. And I think that's the unique part of what Experian does in this revenue cycle space compared to all the other competitors. I have the data to know what Jason's financial disposition is, And so before I even arrive at the facility, I have the ability to get me on the right financial pathway, right? Does he need financial assistance? Does he need to be on a payment plan? What's the right insurance to bill? Does he need an authorization? We can get all those decisions made up front, make sure the bill's going to get to the right, get to the payer. It's going to be clean. It's going to be paid efficiently. And from a patient perspective, we get him on the right financial pathway. And identity-wise too, and this probably going to be one of the things I'd like a customer to call us about related to COVID too. One of the other huge problems in healthcare is around identity, right? And so we have we have the database of every consumer in the U.S. at Experian, and get to see all of these life event changes that they have because of our position of being a credit bureau. We have the ability to know things about like duplicate medical records and have be able to link the right patient to the right record inside of the hospital medical record system. And there's so many good things that are created by getting identity right. You reduce the risk of very bad things that could happen from a clinical perspective. And there's all kinds of administrative and financial issues that are caused by getting identity wrong, right? And we have the ability to ensure that identity is done right. It's done right up front and the first time, and it eliminates all the clinical risk if you get it right, and then all the administrative and financial overhead that's created by getting identity wrong. We can greatly improve the identity, the way identity is managed for our customers. And I think specifically related to COVID, I think that's one of the areas I would start, right? One of the things we've seen related to how our providers are responding to this pandemic, there's testing being done in parking lots. There's pop-up hospitals being set up to arrive these patients through emergency rooms are overwhelmed, and those getting identity right's a problem, right? And so having the tools to get in those first responders' hands that could make sure that is the patient, get them linked with the right medical record, could dramatically reduce the risk of any medical things that could go wrong by the wrong records being selected. And it also will help a lot of the administrative things that need to happen on the back end if identity is done right. And so I think identity would be one thing that we would certainly want people to call us to help manage. And I think that's also we're seeing a lot of these doctors that can't see patients the traditional way try to use telehealth platforms or tools that they have inside of their medical record systems to do remote visits and do more of those things, making sure that we get patients enrolled and authenticated through that Precise ID platform. We'd want them to call us about that as well.
So is there anything other than, I mean, you mentioned already so many things, but is there anything specific that Experian is doing to prepare for the recovery that's going to happen?
Yeah, I think a lot of the things that I did mention. So we're continuing to develop those solutions that are going to enable patients to interact remotely with providers. We're also one of the things that we're going to see happening. There's going to be a surge in these elective procedures that nobody's been doing. We're making sure our customers are prepared to go check do all the business related functions to get back to normal. We're making sure that we're prepared for that as a business, and we're prepared for our customers to get back to business as usual from that perspective. I think the biggest thing from the new normal, if you want to call it that we foresee coming out of this, is really making sure that we have all these solutions available that are going to help patients do business with their providers in this new way that we think is going to be, or it's going to accelerate this new way of doing business. And we want to make sure that our customers are prepared to meet that demand that patients are going to have.
Jason, you shared so much amazing information with us today. Thank you so much. Is there a place where people can go to find out more information about some of the things you've talked about?
Yeah, absolutely. So they can go to www.experianhealth.com and see information related to all of our products and services and how we're helping customers through the COVID pandemic.
Great. Well, Jason, thank you so much. Really appreciate your time. Really appreciate you being here with our listeners and viewers today.
Yeah, thank you for having me.
All right. This is Colin Hung with Healthcare IT Today. Thanks for watching.